Hello students, so now we'll be continuing with your further solving of your MCQs, right? In the first video, I hope you have understood a technique of how to solve questions. We'll be proceeding further. The next question that we have to discuss is a previously asked repeat. Most of these questions are previously asked. This question has been asked around 2 to 3 times prior, right? To identify the key microorganisms in periodontal disease, Koch's postulates has been modified by which scientist? Has been modified by dash. Identify the key microorganisms in periodontal disease. Koch's postulates has been modified by dash. Right. You should know Koch is a very important. He was a very important microbiologist who gave certain postulates or theorems identify which organism is causing or is responsible for the disease. For example, syphilis is caused by your syphilis bacteria. Your tuberculosis is caused by your Mycobacterium tuberculosis. Typhoid is caused by your Salmonella typhi. Same way, to identify the organism that is responsible for the disease, Koch has given certain postulates. And according to Koch, for an organism to be responsible, to be called as the etiology or a responsible agent for a disease, is that the organisms should be isolated. The organisms should be isolated from the diseased person. It should be isolated from the diseased person. It should be grown in pure culture. It should be grown in pure culture. Number 3, these organisms, when injected or when inoculated in a host, it should cause the disease. And number 4, from this second host, you should also be able to isolate the organism. This was the postulates or the conditions that was given by Koch in order for an organism to be called as an etiology. But the problem with Koch postulates, especially with respect to periodontal pathogens, is that your periodontal pathogens cannot be grown in pure culture. Periodontal pathogens cannot be cultivated in pure culture. That is why this Koch postulates has been modified by a person called as Sokransky. The answer to this question is Sokransky. He modified Koch's postulates and he gave his own postulates, which were called as Sokransky's postulates. And as per Sokransky, is that the organisms that are suspected to be the etiology should be increased. The number of organisms should be increased in sites of disease. It should be decreased in healing lesions. These organisms should invoke an antigenic response from the host, like that of your periodontitis. It should invoke an antigenic response from the host. Number 4, it should demonstrate characteristic virulence factors. Right? And these were the postulates that were given by Sokransky. The answer to this question will be Sokransky, and it was a modification of Koch's postulates. And the disadvantage of Koch's postulates is that all the bacteria cannot be grown in pure culture. Right? Coming to the next question, a central gram-negative core supporting outer cochal cells is called as a central gram-negative core supporting outer cochal cells. Right? This is a feature, or this is a type of bacterial arrangement. This is a type of bacterial arrangement which is seen in plaque. Bacterial arrangement that are seen in plaque. That is, let's say you have a central core. You have a central core of gram-negative rod. Rod-shaped bacteria are shaped like a stick. So in the center, you have a gram-negative rod on which you have your cocci, which are arranged like this. You have cocci, which are arranged like this. a central gram-negative rod over which your cocci are arranged like this in clusters. And this arrangement, it resembles, let's say you have the habit of going to the market and eating corn, hot corn, right? This arrangement looks like something like the arrangement of a corn. That is why it is referred to as corn cob arrangement. It is referred to as corn cob arrangement. A central core of gram-negative rod over which cocci are attached like corns on a central stick. This arrangement is called as corn cob arrangement, and this arrangement is characteristically seen. This question has come. Another question that has come is this corn cob arrangement is characteristically seen. Is it seen either in supragingival plaque or is it seen in subgingival plaque? Is it seen in supragingival plaque or subgingival plaque? Your corn cob arrangement that I've drawn in the diagram is a characteristic feature of supragingival plaque. It is a characteristic feature of your supragingival plaque. Whereas your bottle brush or your bristle brush arrangement, the bristle brush arrangement is a feature of subgingival plaque. Right? It is arranged like this. A bristle brush arrangement is a characteristic feature of subgingival plaque, whereas corn cob, it is seen in supragingival, a central gram-negative rod over which cocci are attached. The next question. Which among the following is true for nug? Which among the following is true for nug? Right? Always remember, students, is that in your MCQ, in your NEET exam, it is an objective exam. There can be one or more correct answers. If there are one or more correct answers, you have to choose the best possible answer. You have to choose the best possible answer. Right? If option A is true, option B is true, look for option D. It might be all of the above or both A and B. In that case, you have to choose D. But if you have to choose between, if there is no all of the above option, if there is no option as both A and B, you have to choose the best out of option A and B. There is only option of one correct answer. You cannot give an excuse. Sir, even B was correct. Why is the key given as A? There is only one key. Right? So you have to choose the best possible answer among these. Right? That is why I put this question. Now, nug. Which of the following is true about nug? Option A, uncommon in children. Option B, immunity develops after acute episodes. They've asked which is true for nug. Option C, does not have any specific duration. And option D, contagion, meaning it is a contagious disease or an infectious disease. Right? While teaching you nug, we have studied that bacterial nug is an infectious disease. That is, it is caused by a bacteria, but it is not contagious. It is not contagious or communicable. So you can eliminate option D. You can eliminate option D. Option B, immunity develops after acute episodes. Right? There is no such thing. That was the feature of your herpetic gingivostomatitis. But there is no immunity development after acute episodes in your nug. That is also eliminated. Right? You are sitting in the exam on your day, you get a question like this. This is how you can at least try to solve this question. You try to eliminate the options one by one. You try to eliminate the options. Right? If you can eliminate two options, you have to attempt this question. There is no other option. You have to attempt this question. Right? Come to option A and C. Option A, it is uncommon in children. Yes, which is the disease that is common in children? In children, it is your herpes or herpetic gingivostomatitis, primary herpetic gingivostomatitis. Nug we have studied, it is common in adults. And option C, it does not have specific duration. Even that is true. It is your nug which heals in 7 to 10 days. It is your nug which heals in 7 to 10 days. It is your herpetic gingivostomatitis that heals in 7 to 10 days. There is formation and rupture of vesicles. There is self-limiting disease, that is herpes. Your nug does not have a specific duration. But still, this question has come in your exam. That is why I'm discussing it with you. It's a controversial question, tricky question. So if you have to choose between option A and option C, right? I told you have to attempt this question because two options are eliminated, right? There is a high probability that you will get a negative mark. Still, my advice is attempt such questions. Most likely, you will end up being a correct answer, right? Option A is true, option C is also true. You have to choose the best answer among these two. What is the best answer? The best answer will be your option A. The best answer will be your option A. Because why option A? Why option A? I told you this nug, it is an opportunistic infection. Opportunistic infection, that is, you have to have any other systemic contributing factor, any other factor which suppresses your immunity for the development of your knock. It may be HIV status, it may be uncontrolled diabetes, your smoking, stress, right? So if you do not have any of the other condition, there is a very rare possibility that you will develop NUG. So in your children, a child does not have this much stress. He doesn't smoke. He doesn't have, that much uncontrolled HIV, uncontrolled diabetes, very rare. So NUG rarely occurs in children. Whereas primary herpetic gingival it occurs most commonly in children. That is what they're asking by this question. Even though option C is true, it doesn't have a specific duration. But option A is a better answer. Better answer. Please understand how your MCQ works, how to solve an MCQ. You have to choose the best possible answer. And option A is any day better than option C. It is rarely occurring in children. That is a characteristical feature of NUG. Right? Next question. Gingival curettage is contraindicated in all except. Read the question thoroughly. Gingival curettage is contraindicated in all of the following except. Okay, two negatives make a positive. Contraindicated and except. That means they are asking you in which condition you can do curettage. Curettage is contraindicated in all except. That means in three of the options it will be contraindicated. In your answer it can be done. Or gingival curettage can be done in which of the following conditions. Right. Option A, adequate crown to root ratio. Adequate crown to root ratio. Crown to root ratio means ratio of the crown to the root. You would have studied in your Periodontics, in your FPD, right? An ideal average crown to root ratio should be 2 to 3. An ideal should be 1:1 and all that, right? Inadequate crown to root ratio can be a problem. A deep periodontal pocket, it warrants a periodontal flap surgery. In areas of aesthetic appearance, I have discussed in the case of your maxillary anteriors, you try to avoid any surgical procedures as long as possible unless it is a severe periodontal disease wherein you do a papilla preservation flap. I repeat, in your maxillary anterior region, if you have a mild to moderate pockets, you simply do a scaling and root planing. Only if you have severe pockets do you shift for a papilla preservation flap, right? Otherwise, as long as possible, you try to avoid any surgeries, and curettage is a type of a surgical procedures, right? So it is rarely done in maxillary anterior. If at all you have a deep pocket, you directly do a papilla preservation flap. NUG. NUG is an acute condition. So in NUG, in the acute phase of the disease, you never do any surgical procedures. You never do any surgical procedures. The maximum what you can do is you take a cotton swab, dip it in LA, dip it in hydrogen peroxide, you dab the pseudomembrane, you remove the necrotic tissue, you irrigate the pocket, you give the patient antibiotics, a superficial scaling is done. When the acute phase is subsiding, you can do a proper scaling. But surgery is not done, not only in NUG, in any acute condition. In any acute condition, you do not do a surgery unless it is life-threatening, right? So the best answer is inadequate crown root ratio. What is the problem? Adequate crown root ratio means a normal tooth. Any tooth which has a normal crown to root ratio, if you have an edematous pocket, you can do a curettage procedure, right? So that is how you solve by elimination. This question we have solved by elimination, by eliminating the options. That is, in NUG, there is no surgery. Surgery is absolutely contraindicated. In areas of aesthetic appearance and maxillary anteriors, mild to moderate pockets, do a simple scaling and root planing. Deep pockets, papilla preservation. So even that is eliminated. You have to choose between option A and B. A deep periodontal pocket always warrants a periodontal flap surgery. Eliminate even this option. Best option is option A. Option A. Adequate crown to root ratio. They are signifying the most commonly occurring condition in the oral cavity, a tooth with adequate crown to root ratio. Okay. The next question is, neighbor's probe is used for what? Neighbor's probe. Okay. Another question from instruments topic. Option A, to measure the pocket depth. Any probe, the main function is to measure pocket depth. For bone sounding we have read, it is a other name for transgingival probing. For transgingival probing, which is nothing but option B. Option B and option D are the same, right? They have just given the synonyms. So most likely, if two options are the same thing, most likely they won't be the answer, because both are meaning the same thing, right? A neighbor's probe is a special kind of probe that we have read. It is used to measure the extent of furcation involvement. I've told you it is a curved type of probe, so that it goes into the furcation region and you measure the extent of horizontal furcation involvement. Not only that, this neighbor's probe is graduated at every 3 millimeters, 3, 6, 9 and 12 millimeters. It has 4 markings, right? Next, what is bone sounding? Bone sounding or transgingival probing, it is a clinical method. It is a clinical method of assessing the type of bone defect. Clinical methods of identifying or assessing the type of bone defect. That is, what we do is we give an anesthesia and we put the probe through the gingival sulcus and feel the type of bone defect that is present, right? And one important thing is that the probing force for bone sounding, the probing force for bone sounding is 50 grams. It is almost double that of your normal probing force, right? That is how you completely dissect and learn the question. It's not like you read the question and study it as option A, B, C or D. The answer to this question is furcation involvement, option C, but you should know important points regarding bone sounding and transgingival probing. It is one and the same. Next question that we have to discuss is magnetostrictive instruments or scaler shows which motion, right? So this question has been taken from your power driven instruments. We have read power driven instruments can be classified into sonic and ultrasonic scalers. Ultrasonic scalers further divided into magnetostrictive and piezoelectric. Magnetostrictive and piezoelectric, right? Sonic scalers vibrate at a frequency of around 2000 to 6500 hertz, whereas ultrasonic instruments have a frequency of 18 to 50 kilohertz. That is 18,000 to 50,000 hertz. Then ultrasonic further divided based upon their principle of vibration into magnetostrictive and piezoelectric. And while teaching you, I told you sonic and magnetostrictive have the same property, that they have an elliptical path of vibration. Elliptical path of vibration, and that is why they have 4 active surfaces. They have 4 active surfaces, working surfaces, whereas piezoelectric has a linear motion of vibration, leaving it to have only 2 active surfaces. The best answer for this question will be magnetostrictive, they have asked. So this magnetostrictive has an elliptical path of vibration and 4 active surfaces. Same is the case of your sonic. If the question was also sonic, it will have been the same answer. Whereas linear motion is for your piezoelectric, instruments or piezoelectric scalers, right? Again, please open your book and look at the pictures of your scaler. This picture of an ultrasonic scaler has come in your exam, right? So that is how we learn MCQ based theory learning, right? From the question, you revise the entire topic about sonic and ultrasonic scalars.